Okay, so we have the recording started, which means we are in our third session of the day for Science for a Sustainable Arctic, now back with a panel on human health, well-being, water cycle, and ecosystem change. And so I'll hand it over to our moderator, Ásthildur Sturludóttir, Mayor of Akureyri. Take it away, Ásthildur.
Thank you, Alan. I would like to welcome you all, not to Akureyri like we were planning, and I do hope that we will be able to have you here later on in the future and hopefully very soon. It's a pity that these times are going on, these unbelievable times that we will remember in the future as a historical one. But we are using technology. Fortunately, we can do that and keep going with the conference that was planned. Today we have these 5 great panelists, and I think we should just start with them. There is nothing more to say about me. I'm just the mayor of Akureyri, and yes, maybe to add to that, I'm the chairman of Arctic Mayors Forum. But our first person today is Arja Rautio. She is a VP research at the University of the Arctic. She is the Arctic professor and director of Thule Institute, Faculty of Medicine in the University of Oulu. Her research interests are on population studies, indigenous health and well-being, research ethics, environmental, and One Health and under climate change. So Arja, I would like you to start today.
So thank you very much for this very kind introduction, and so that it's great to be in this kind of panel, which is existing so that without any publicum, so that just talking with the computer, but of course I can see the other faces. So I have been working, I'm a medical doctor in my training and European registered toxicologist. I have been working in the field of the health and well-being, and during the work I have noticed since 2006 that it's really important to have a very big picture about the health, so that it's including the well-being, it's including the quality of life, and also the living conditions of the people. And so that when we are talking about health of people, we should also look in the points which are surrounded, so that we need definitely clean air, we need the clean water, and also the very good quality of food. So that, and all this is surrounded by the nature and environment. So that I think that we cannot have the health research without connection with the environment and wildlife and all what is happening. And of course, I think that in many cases, the politics and industries, economical things, and of course the climate change, they are changing a lot of our positions. And especially now when we have this kind of coronavirus pandemic coming, and it's a one health issue, so that the health is covering by the environment, wildlife, domestic life, of course, the animals, and also the humans. So that without the good quality of or good health in the environment, we don't have a good health of the people living in the Arctic. And I think that when there have been these huge changes in the demographic factors, it is also a change that people are moving to the bigger cities, so that we should have the looking the things which are happening in the rural regions, and also what are happening in the big cities. And in my very close in my heart is also the multidisciplinary research, so that we can have many disciplines together. But it is also so that we could cover the whole circumpolar Arctic, also Russia. And I think that it is an issue we should focus more and more together, and also having the collaboration between the different networks and different actors who are working in the health and well-being topics in the Arctic. So I think that this is my starting.
Thank you, Arja. Thank you very much. It's important to get this. Arja is in quarantine, isn't that true? Yeah, she is in quarantine.
Yes, I'm in quarantine now, so I have to be 3 more days so that I have
then
been...
You're free.
Yep.
Then you're free. She wouldn't have been able to attend if we would have been in a physical contact. So thank you, Arja. Next, we are going to go to Iceland. Jón Ólafsson, Dr. Jón Ólafsson is a freshwater ecologist at the Marine and Freshwater Research Institute in Reykjavík, Iceland. And he is also a guest professor at the Agricultural University of Iceland. Jón's current field of research focuses mainly on structure and function of freshwater ecosystems in relation to warming climate. So please, Dr. Jón Ólafsson, would you make your introduction now? We can't hear you, so please take off the mute.
Anyway, here we are. Do you hear me now?
Yes, we can.
Okay. Yeah, thanks very much. And thanks for inviting me. So basically, I've been working on, like Ásthildur said, I've been working on freshwater ecosystems mainly in the subarctic or in Iceland. And working on how the ecosystem, how they possibly would alter or change to warming, but not only warming, but we are also with the climate change, we see different picture in precipitation, for instance, and runoff. So we have been working on research here in Iceland using geothermally heated ecosystems to basically predict what we can expect with the increasing warming and also increasing runoff of nutrients to streams and lakes, etc., etc. And that's something we have to keep in mind, that it's not only temperature, but it's also changes in precipitation. We have to bear in mind when we are talking about freshwater ecosystems in northern latitudes that the diversity, the biological diversity is low. So typical freshwater ecosystems in the north is characterized by insects. I mean, mosquitoes, midges, or similar sort of small diptera insects, and secondly by crustaceans. So what the fish, which is again is very it's not a high diversity of fish. So Arctic char is the sort of common circumpolar fish species, is relying on these crustaceans and insects to feed on. And another characteristics with the northern latitude freshwater ecosystems is that they're oligotrophic. So oligotrophic means basically that there's a very low nutrient characterizing these streams and lakes. So what I want to emphasize here is very little input of nutrients or any chemicals or any anthropogenic effect on these oligotrophic systems. It may make a huge change, because so they reach, flip over or reach their tipping point or go beyond their tipping point in terms of diversity, etc., etc. I think I will, yeah, and basically going back, just one more thing, going back to our experimental work here in Iceland, where we are actually predicting what may happen when with the warming and is that we will see a huge shift in the species if there are plants or if there are animals. So we will get new species and the cold adapted species, whether they are insects or if they are fish or whatever, they will disappear or go further up north, and we will get a new species such as brown trout or salmon or whatever. And some people might say, okay, that's great, yeah, but it's great to a certain extent, because beyond that we will get cyanobacteria or blue-greens that will change the ecosystem to such a degree that fish is not actually going to thrive in those systems that are dominated by cyanobacteria. And I think I'll stop here and leave it to discussions. Thank you, Ásthildur.
Thank you, Jón. Listening to you, I start to get afraid of my salmon fishing and my salmon fishing in the future. And that I might have to find a new interest during the summer, but you might describe that and answer that question and later in the panel. So going to Greenland, Victoria Rose Buschman, she's a conservation research fellow at the Greenland Institute of Natural Resources in Nuuk, Greenland. She's a fifth-year PhD candidate at the University of Washington School of Environmental and Forest Sciences in Seattle in the USA. So I would like to ask you, Victoria, to take the floor. And we have to mention that there is a blizzard in Nuuk. So we might hear some windy noise, but take it away, Victoria.
Hi, good morning and good afternoon. I'm so happy to be here, even though only digitally and not in person. I had still been looking forward to coming to Akureyri because I had lived there for a year. And I really was looking forward to seeing everybody in my old office and friends in town. But about myself, I'm an Inuit conservation biologist. I'm originally from northern Alaska, but now I live in Greenland. And my specialty is the conservation of lands, waters, and species in Arctic indigenous homelands, which is a broad specialization, but there aren't very many people who are focusing on how conservation really is supported by a lot of indigenous communities and how conservation is so integral to so many other aspects of life in the Arctic. So I do a little bit of work on assessments for different protected areas and also assessments of different conservation plans for some of the most controversial species in the Arctic, particularly species that are of both conservation and subsistence interest. So the species that we want to conserve, but the species that we also want to eat. And to bring in some of the topics that are being presented during this particular session, they're all so important within indigenous communities because they're so interlinked, such as I'm a conservation biologist, but so much of access to the land and the ability to interact with species and waters is an important part of indigenous well-being. And so I'm not a health professional, so I cannot comment on a lot of the particular medical and health factors that are involved, but there are a lot of other angles and lenses through which to look at well-being in some of these communities. So I'm happy to discuss some of these things further during this panel.
Thank you, Victoria, and it's great to have you. And it's wonderful that we could make a connection. And we believe it's tough in Greenland now. We have closed off from the rest of the world. So all the best regards to Nuuk. But we will listen to you more in the panel. Thank you. So next to Akureyri, Eydís Sveinbjarnardóttir is the Dean and Associate Professor at the School of Health Sciences at the University of Akureyri. Eydís is a psychiatric mental health nurse. Her research emphasis is on implementation of family nursing and brief family support into routine clinical practice. in psychiatry, healthcare, and into the welfare system in general. And I must mention that, like in Iceland, it's a small nation, and of course, me and Eydís, we are related, like every second person in Iceland. So I'm really proud of my relative here. And Eydís, if you could take the floor now. Take off the mute.
Yeah, thank you. Thank you, Ásthildur. I was going to mention that we were related as well, but you have taken it from me, but nice to be here. Dear Arctic colleagues and friends, the words of Arja Rautio are mine as well, and we both have the emphasis on one Arctic, one health. I think we do agree on that. I agree with Ásthildur. I'm a little bit afraid of my salmon fishing, but hopefully those will not be postponed next summer. That is very close to the springtime now. We are living exceptional times at the moment. Our generation has lived through several outbreaks and epidemics, but fortunately not many pandemics. We, the Icelandic people, are in general quite satisfied that our government and politicians who have made their decisions so far on how to respond to the coronavirus on evidence-based knowledge and clinical guidelines from our health authorities and epidemiological scientists. In our still homogeneous society, we are fortunate to be able to coordinate our actions together at least enough to flatten the curve. The scientists have designed on epidemiological research, getting the support from the government and policymakers to continue our resilient journey. Stressful and traumatic life events like pandemics may result in depression, anxiety, and possibly enhanced suicidal risk in vulnerable population. We have to think about that. Mental health and well-being is at high risk that we have to attend to in the midst of COVID-19 and also the years following it. Hopefully, policymakers, both in local and state governments, realize that it will be a long journey. In my psychiatric nursing professions, patients have been my clients, but being a dean, the students and academic staff are my clients now. My students are under extreme stress at the moment, especially my nursing students. They are in the midst of final projects and examinations of the spring semester, but at the same time, the healthcare, that is hospitals, community healthcare centers, old people's homes, are calling out for their contribution to service immediately because of the situation with the virus. And on top of that, they have their own families with young children. We have now the first results of our student survey that has been done to assess the well-being of students at the University of Akureyri during COVID-19, and they are devastating. The survey is open until noon today, so we only have now the results of 30% of our students that have answered. And I have to tell you the numbers. 85.3% of students agree and totally agree that they are experiencing anxiety because of COVID-19. And 71.9% are experiencing depression symptoms. 87.6% of students agree and totally agree that they are experiencing more stress and burden the last week, which is affecting their educational performance. More than 40% of students answered that they did not agree and totally did not agree to statement that they would reach their goals in finishing their courses with their aims in the beginning of the semester. Universities all over the world are helping students now to finish the 2020 spring semester without losing the quality of the education and at the same time trying to protect the mental health of students. This is a huge project over the world right now, a huge challenge, which needs the collaboration and support of governments, university boards, and last but not least, our academic staff. I wanted to get this through to you. Thank you.
Thank you, Eydís. These are devastating numbers and really stressful to hear how really stressed the students are. I think we could apply it to the society as a whole. I think everyone is going through a very stressful situation at the moment, wherever you live in the world, not only in Italy, Spain, China, but also in other countries that have not been affected as hard as these countries. So we have this slow incrementing shock that is coming over us, and I think this is really something that we need to focus on, and especially in the aftermath. So thank you, Eydís.
Thank you. Next,
but not least, is Peter Sköld. I hope it's is the right pronunciation. He is the professor of history, Sami culture and society development at the Umeå University in Sweden. He is the director of the Center for the Arctic Research, or ARCUM. Sköld's research profile includes Arctic sustainable development, historical demography, population statistics, indigenous health transitions, and northern culture. So thank you, Peter, for attending from Umeå, and please take it away.
Thank you so very much, Ásthildur. I would like to make a few introduction comments based on the perspectives of research, of course, and human health and well-being especially. And with the stubbornness of a fool, I repeat that a prerequisite for the best opportunities for Arctic human health research is an understanding that the Arctic actually is a region with people and an ecosystem, and not only a sea that you can only visit on board an icebreaker. That is truly important as well. But if we want to see this as something that concerns people, well, we must include it. And unfortunately, many policymakers see health issues only as a part of the regional development, and they also direct the health issues to that context, and that is not good for international cooperation. And we can see this also in the national reports from the Arctic Science ministerial meetings and the specific national Arctic strategies. Health is pretty marginalized in these documents, I must say, and should not be, of course. Nevertheless, we can conclude that science makes strong efforts, even if it is based on regional studies very much. And what I mean is that we need more big pan-Arctic comparative studies where data that is today incompatible and inconsistent is improved and adjusted for comparative studies. I also, as some of you have already stressed, mean that the One Health concept is the concept to have if we want to progress on this. And ironically enough, you could actually claim that the One Health context is indigenous. That mirrors an indigenous way of understanding this world and how things go together. So I must say we were not the first to introduce this perspective. And with that said, we also face challenges in incorporating and inviting indigenous knowledge holders to our Western-dominated science paradigm. We make strong efforts, but there is a lot to do. And I just want to remind you that there are great wins if we are successful with this. Take, for example, Tu Youyou, Chinese Nobel laureate in medicine, 2015, who discovered that wormwood could be used against malaria, and today have saved millions of lives probably. And the base for this knowledge was found in 1600-year-old texts. That is traditional knowledge. There have been many achievements, such as improved bilateral cooperation, digital solutions, and improved cultural skills among health personnel. But at the same time, the North has often witnessed a dismantling of health services, and that is a big problem. And I want to remind you that indigenous health remains a big challenge, not only in the Arctic, but throughout the world. The mean life expectancy is so much lower among indigenous peoples. And in the Arctic, we see how these high morbidity levels, together with infant mortality, infectious and parasitic diseases, obesity, diabetes, suicide, mental health, fatal accidents, and domestic violence remain challenges. And I'm convinced that research can contribute a lot to improve this situation. Thank you.
Thank you, Peter, for your very good introduction and reminding of the traditional studies that is important to listen to, and also the collapse of the healthcare systems in the rural areas. I think that is one of the biggest challenges, the dismantling of the infrastructure of the Arctic. And because I was a mayor in a very small society with only 1,000 people before I became the mayor here in Akureyri, I know the challenges that this can make. And I know how tough it is to be a pregnant woman with a lot of side things to deal with in a rural area, and how scared you can be under these circumstances. And not to mention if you live far away in the Arctic. But I would like to ask the participants to send in questions, but I think we should start with questions, and I would like to start with questions to the panelists. And because we were talking about how we can support the good health, how we can do that, I would like to ask the panelists that I have in mind, Arja especially, how do we support good health in population in the Arctic? Then I'm referring to both in the rural and urban regions. How do we do that? Can you say something about that, Arja?
So thank you very much for the question. But first, I say some comment to Peter's presentation. So that at the moment we have established a Lancet Commission concerning the Arctic health, and there's idea so that we have this scientific knowledge and indigenous knowledge. They are going in like two rows. And I think that that's also the way to introduce the things which has been already known so long time in indigenous world, and it's a way to make the visible of the voice also in the health and well-being. This Lancet Commission, we will give a report, and we have just started the work in the beginning of this year, and it is a 2 years project ongoing. So I very much wait what are the results of this work in that commission. But about how to support all the health professional work and healthcare system in the whole Arctic, so that as Peter and many others, you say that there's so many different types of the region and territories. And also, I think that that's also the key issue that it is needed not only one way to go forward, but I think that definitely it is so that all those cultural sensitive ways in healthcare issues, and also to giving the education in a way which is cultural sensitive, for example, to promote the health issues in the population. And in that issues, it's also needed to use those modern technology, what we have, not in all areas, but some of those. But I think that it is so important to have the indigenous nurses, medical doctors, social workers, other therapeutists to be working in the very small communities, or how to have the connection so that people can be taken care also in the issues when the elderly people are staying to the villages and small places, and when the young ones are moving to the bigger cities. But I think that it also needs us having information from all Arctic regions. And for example, in Sami health issues, we don't know so much because we have not indicated who is Sami and who is non-Sami. So that is in some of the cases when the healthcare system are reaching very well the people, but there are also some of the issues which are inside the community or inside the indigenous group, like Sami population, which is living in these 4 countries. But I can see that I think that all these attempts and all these ways which we are including health and well-being, living conditions and good quality of life in the research and education, they are promoting the health issues in remote areas. But I'm very worried about the urban regions, so that indigenous people, when they move to the bigger places, bigger cities, and it is also seen in Finland, so that people are moving to Helsinki or Turku or whatever bigger cities in Finland. They feel lonely, and they have also the higher risk for the suicides and mental depression. So that there is a lot of issues to be done, also looking the healthcare system and also the mental support, the mental wellness of the indigenous people when they move to the bigger cities. And sometimes I think that we are not so much focusing on that. But I don't know if this was answer.
This is very very good, Arja, and you mentioned elderly people. Here in Iceland, for example, the rural areas, they are full of very old people, and if we can say that the northeastern part of Iceland is like one big nursing home. So these are very delicate areas, and it's common when people move to Reykjavik or to the bigger cities, and they become isolated. So in addition to that, I would like to ask you, Eydís, especially concerning the COVID-19 and the research that you were referring to, and also maybe that we have been talking about the rural and more isolated societies here in Iceland as well. Do you think that the mental health is underestimated during this crisis, or are we just seeing that the numbers are that they are high and they might become higher?
It's a good question, Ásthildur, because, for example, in the which is not comparable, but is a trauma that we went through 10 years ago with the economic collapse. It seemed that during the collapse, people really stuck together, and you had a lot of collaboration between the societies, and people really were doing different things than they had done before. But like the Finns, we learned from the research from the Finns that the mental illness and the mental problems came later on, after the collapse. And I'm wondering, although this is a very different thing, pandemic, is that it seems to be the atmosphere at the moment is that at least here in Iceland, and I guess it might be in other parts of the world as well, as you see on Facebook, that people are actually doing a lot of things for themselves, although it's it's a stressful situation. I would think that we have to be taking care of people mentally and much more in the following years. I mean, people are so busy now just following the news on how many are infected, how many have we, how many have gone for samplings, how many are in quarantine and so on. But I think the focus on the mental health is just right behind the corner. And I think, for example, that the infrastructure in the healthcare really has to think about it. And I think we are starting to look at it because I think we are not ready for all the mental health issues that are going to run our way. And we think we really have to be having we now have to think about protected measures, like how are we going to really we have to take preventive measures. We have to take special care of vulnerable populations. I have heard talks about the homeless, refugees. There are a lot of vulnerable people in the world and in the Arctic at these times. And the access to healthcare, and we talked about I think we have to think about the infrastructure like you've been talking about in the rural areas. I feel we have always been thinking about the infrastructure and making the healthcare system strong in the urban areas, but the rural areas, they are more vulnerable. And we, of course, need all the measures of the government of financial help, relieve stress, and we need a lot of flexibility, I think, in the local governments to really put finances into mental health at the, following after we've flattened the curve. I think there are a lot of issues concerning mental health. Yes.
Well, I think you and me could have a very long chat about mental health, especially in the rural areas.
Yes, yeah.
And,
but I would think that would be the same in many of the Arctic areas.
I think so too. I definitely agree. But if we take the focus a little bit from the healthcare and health issues, and I would like to, there is a question that came from the audience directed to Jón. How does the change of precipitation affect the level of cyanobacteria and insects in the streams and lake system? Jón, if you could answer that.
Yeah, I must unmute before now. Yeah, the person has sent me an email, and I think we will be in sort of direct contact. But generally, we are talking about temperature, increase in temperature, which so it's not only. Do you hear me? Yeah.
Yes, we can hear you.
Okay, fine. So it's a combination of changes in pattern of precipitation. So we get a runoff nutrients to the catchment areas, to the streams, to the lakes, which then includes nutrients that cyanobacteria can use. And cyanobacteria, they fix nitrogen from the atmosphere, so that's the advantage to another algae, such as diatoms, etc. So increasing the temperature, combination of increasing the temperature and changes in runoff and to the streams and lakes in May. Just notice I say May, and this is from our experimental work here in Iceland, may increase the cyanobacteria. And cyanobacteria, for those who are not familiar, cyanobacteria are sometimes regarded as a dead end in the food chain. So there are not many insects or crustaceans or invertebrates, generally speaking, that are actually feeding on cyanobacteria. Instead, they are feeding on diatoms and green algae, and some of them are feeding on plants. So cyanobacteria is not as in increasing in biomass of cyanobacteria due to increase in temperature and changes in pattern of precipitation is not necessarily good news. And I'll regarding the specific question, as I say, I'm in touch with this person directly.
So thank you, Jón. You might hear a little noise in the background. There is some construction going on in the house. We are using the time while nobody is in the city hall. But there is a question here from Jennifer Spence. My question is for Victoria and Peter. What types of initiatives do you think we need to better demonstrate the power of indigenous knowledge to inform approach to human health and well-being? If Peter could start.
Yes, thank you. First, I should just connect very briefly to the previous discussion and of course state that mental illness in the entire population is so much more than the fear of being infected or relatives being infected. We know that many people lose their jobs today, and the relation between unemployment and mental illness is unfortunately very strong. And then also informing you that the University of Northern Iowa, the Arctic Center there, has put up a web page where you can follow the development of the COVID-19 virus in the Arctic for those interested. Then to the question, I think we should, and we do, cooperate and cooperate more. We know that we need indigenous knowledge holders in our projects. We know now that they should be included from the very, very beginning of the planning of every project and not be introduced at a later stage when all the questions and the model has been set up already. And also what Arja says, I was hoping you should mention the Lancet project, Arja, because I think it's a very, very good initiative. Really, and I think also it demonstrates what we sometimes call the two-eyed seeing. That means that we don't all the time try to twist Western and indigenous knowledge into something new, but we have a parallel track where the participants are double informed. They have an insight and knowledge from two perspectives, and then they can draw conclusions based on what has been provided from each perspective. And I think that is one very, very good way of working together and to include indigenous knowledge in this research.
Thank you, Peter. And Victoria?
Hi, sorry, my internet dropped out a little bit, but I'm back. I didn't get all of Peter's response, so hopefully I won't give you anything extra, but I would have two comments to this in particular. I would say first that I think that the health issues in the Arctic, at least in the Inuit homelands, are not a mystery. We know what the health issues are. The problem is that we don't necessarily have the funding or the power to do anything about it. For instance, there has been a long history of health directives in indigenous communities in the Arctic being more detrimental to the people than helpful. For instance, there was, back in the 80s, a number of discussions about how Inuit needed to stop eating a lot of our marine food sources because of heavy metal contamination and such. But it turned out that, well, there's some research, it's still not entirely clear, that actually the selenium that is in the skin of the seal is counteracts some of the physical manifestations of heavy metal poisoning in indigenous communities, and that we were starting to see much more toxicity after people were told to change their diets than before. So I think that this is one aspect of it. There is an issue with health directives have not always been positive for us. And the other is that we know what we would like to do. For instance, the exchange of indigenous knowledge between different generations is considered a very healthy approach to mental health, because it connects you to your community, it connects you to your culture. This is something that people would like to do. The problem is just that even though indigenous communities in the Arctic belong to developed countries, we don't necessarily receive the same kind of funding or level and standard of care that other communities in the US, in Canada, in Europe receive, which is rather a large inequity in the entire process. For instance, Canada has the highest rates of tuberculosis, Northern Canada, in any of the developed world. So there are clear ideas of what we would like to do about health that are informed by indigenous knowledge and our cultural practice, but we don't have the capability of doing these things under the current system.
Thank you. Thank you, Victoria. You have an unstable internet as I do as well. I think there is a enormous usage of the black cable now that is not it can't deal with all the traffic that is going on in the world right now. But it's unbelievable to hear what you see, especially about the tuberculosis and the high rate of tuberculosis in Canada. And according to this, I would like to ask you, do you think that the pandemic could affect these societies worse than other societies in regard to, for example, tuberculosis?
Are you asking me? I'm sorry.
Yes, I'm asking you.
Yeah, I would say the pandemic is scary for us, I think, because a lot of our communities already have complicated health issues. A lot of respiratory diseases like tuberculosis, this is a complication if you contract coronavirus on top of tuberculosis. And we live in such, our housing issues are quite a problem in the Arctic. We are living many people in small houses compared to in other parts of our countries. And so in such close proximity, it is easier to transmit diseases such as this. So there are clear signs that people are concerned, and that, like my own hometown in Alaska has just closed off they have no cases, but they are not letting any human travel in or out because there are serious concerns that if a lot of people contract this disease, we don't have the capability of dealing with it, which is quite scary, I think, for a lot of small communities.
Mm-hmm. And that is also connected to the underdeveloped healthcare systems in the Arctic. And Arja, would you like to add to this conversation, or Peter or Eydís? Arja.
So that this is very, very good point coming out, so that we have like tuberculosis, which is some kind of older infectious disease, and also sexual transmitted diseases, which are very much involved. Also the streptococcus infections, which are mainly having the otitis or having also the lung or through infections. So that it has been very long-lasting follow-up, at least more than 20 years. What are the infectious diseases, how they are going on, what kind of epidemia they are coming into different communities or different parts in the Arctic. But somehow there's one group under the International Union of Circumpolar Health. It's focusing on these infectious diseases, which has been already existing long time, and what are the conditions. And I think that there are those suggestions how to make them better. But as you said, the homes, they are a very small one. There are lack of sanitation issues. There's a lack of many of those things, which is definitely needed. I know that, for example, in Alaska, there have been many of those promotions, how to make the sanitation and how to make the things much more better, so that it would be not so much exposed the people for this kind of the infectious diseases. But of course, when you have a poor health condition and then you have the additional issues coming, for example, now when we have these new viruses, when the ticks are going to the north in some of the other places where they are also existing tuberculosis, so that it's a huge issue together with the contaminants and other things which are you also exposed if you are using marine mammals or so in some of the regions. And now when the permafrost is melting, and so that there are some of the very how I could say, there are chances which we need to have, so that there are many professionals, many fields of the ministries and other things together. And also there's needed to have this talk how we could find the best solutions for the people who are living in the rural regions, but also in the big cities, so that the water quality, for example, in big cities in Russia, it's 90% is there's a bacteria, and 50% there are some of the infectious issues included. So that we have very joint problems and issues to be tackled. And I think that it also needs the political willingness. It needs the national and different levels, and also all the communities, all the actors network which are working in the Arctic.
Thank you, Arja. Anyone that would like to comment on that? Peter?
Just a brief comment. After all, I am a historian. And if we look back to the epidemic history of the Arctic, we can see that some of the infectious diseases that have been pandemic, such as smallpox and the Spanish flu, of course, have devastated communities in the north. That is true for Alaska, North Canada. It's also true for Scandinavia when it comes to the Spanish flu. And the reason for this has often been that these more distant communities and regions have been reached by the viruses at a later stage of the pandemic. Sometimes the virulence of the virus has been more severe at that stage, but also the virus has met a totally unimmunized population. And we can see that risk persists still today with the coronavirus. And my hope is that we will have patience to be alert also for a long time, because this might affect our part of the world at a later stage. Up until now, we have a bit more than 1,000 diagnosed infections in the Arctic and only a handful of deaths. That will change. We know that. So keep on the fight in the north too. I'm happy to hear how alert people are in Alaska, for example, because that is exactly what is needed today. And finally, also just a reminder about indigenous knowledge. The Sami were not at all as affected by smallpox in the 18th century as the rest of the people in Sweden. And why? Well, they understood that the disease was infectious, not caused by bad air or miasma somewhere. And they took off. They took the reindeer, the family, and the tents, and they went a long way, and they stayed there for a few years before they returned again. But in that way, they could also escape from this terrible killer.
Mm-hmm. Thank you, Peter. This is something that we should really worry about for the rest of the area. Iceland remembers the Spanish flu very well, where over 500 people were killed. So these are things that we have in our history books and we won't forget. But there is another there is a question that I think Jón could answer. From Linda Lara. Hi, thank you so much for these talks. My question is, with the thawing of the Arctic permafrost, what kind of microorganism could be released that could affect us? I would like to know if you know what kind of microorganism has had now to be kept in permafrost. Jon, can you answer this one?
Oops. That's a tricky. That's a tricky one because that's not really my specialty. I'm not a microbiologist, so I would rather not comment on that.
Okay.
So if anyone else has got a comment on it, then
Peter says that he is handing up his.
Good.
Yeah, well, I can say first of all, we don't really know. We don't really know what is in the permafrost. We know that, for example, anthrax have come up from the soil a few years ago and years before that. And I can also refer to a study in Tibet, in the glaciers, where they found 28 unknown viruses in the ice, able to escape from that with thawing permafrost. So there is a risk, but I, at this state, would not like to overestimate it.
So that if I say also a couple of words that I'm involved in Nunatoruk project where we are looking the anthrax, the possibility how it could be spreading from the permafrost, so that we know that anthrax it's living there at almost 100 years and so, but also there's a huge number of the mercury inside the permafrost, and now we don't know how much there is coming up, and of course that is a risk for the food and water security issues when the animals are drinking the water or humans and so. But we don't know exactly how it is. It has been a huge tragedies. I think that 1911 there were more than 100,000 reindeers were killed by anthrax. So that we know that there are huge amount of those. And now the persons from Rapon, they have said that they are huge, how I would say, it's a very huge mental and also physical issue, so that when those graveyards, the bodies are coming up now when the permafrost is melting. And I think that that's a huge issue which is now already happening in Siberia and in Russia.
Thank you, Arja. These are things that we really worry about. Now we only have 2 minutes left. There is a question here from Megan Sheremata and Eydís. I'm not sure if, can you see the Q&A? Inuit in Canada have experienced for decades many inequities with respect to health, have dealt with mental health traumas over generations from many sources and continue to deal with a history of TB treatments. How can government health programs best support the remote community's mental health when most of the mental health practitioners in Canada and US are in temperate regions and very removed from the cultural and social blah, blah, blah. Eydís, I know you can answer this. You are on mute.
Yeah, I'm unmuting, and I saw the questions.
Very briefly.
Very briefly, I think in all the Arctic countries we are dealing with the same question there that she is asking. Although we are having affluent parts of our country, and then we are having the rural part that is not so affluent. And I think my hope would be that with distribution of financial qualities between the rural and the urban, and of course also we have to introduce digital health, I thought that we would maybe talk about that more. That was one of the things that we could have talked about more, because now during this pandemic, the world is flying into the fourth industrial revolution communication. And I think that we really have to rethink our infrastructure in those areas. And one of the things is that was mentioned here earlier is that, of course, we need interdisciplinary health services, but research is showing if you have good nurses, they can do wonders, and especially in rural areas. And if they are connected digitally to medical doctors and hospitals in more urban areas, you can really increase the health of the society, both physical and mentally. So we have solutions, but of course they cost money, but they also have something to do with our, what do we say, forgangsröðun, how we
organize people in what order they should
be, yes.
Get the help.
Yeah, the priorities we make in our healthcare system. I think it's a matter of priorities.
Mm-hmm. Thank you. I think we should, what we learn from these times is to use the technology more, and people will be willing to use the technology more. And for instance, for the people that live in the remote areas and in the Arctic areas, we need connectivity, we need connections, and we need to use technology more, and we could help people that live far from the urban areas with technology. But on the other hand, we need to use, we need to get connections to that areas. But I would like to thank you, all the respective panelists for today, and it has been a pleasure to direct this. And thank you all, and have a great weekend.
Great, thank you everyone. I'll just say there are a few still unanswered questions, unfortunately, in the chat. Thank you to everyone who's been asking. You can either follow up directly with panelists over email afterwards, or if the panelists want to spend a few more minutes answering questions in the text box, you're very welcome to do so. Just so everyone knows, our next panel will start in just under 30 minutes. There'll be a panel on changes to Arctic coastal social ecological systems. And the final thing I'll say is just in the chat box, I put a link. If you're interested in another opportunity to network with your colleagues, there's a Zoom meeting room that we have open. It's unmoderated, so you can see who else is there. And you will have to leave this webinar to join that room, but please be sure to come back in 25 or 30 minutes. Thank you so much, everybody.
Thank you.